Okay guys, let's move on to the cranial nerves. And now this is a very important set of nerves that you need to know. And it's very difficult just to learn these parafashion, but I think the best way to learn these is to learn it in conjunction with a scroll, and if you get an image of the scroll and if you get an image of the nerves passing through this, it'll be a lot easier to learn. Now, if we just, let's rewind for a second and talk about the cranium. And there's some structure up here. Let's have a look at the bones of the cranium. Okay, now let's have a look at the cranium, also known as the neurocranium. It's formed by two parts really. The superior part, known as the bones of the calvarium, which is basically the shell, your skull, comprised of the frontal bone, occipital bone, and frontal bone, occipital bone, and the two parietal bones. Together they're known as the calvarium. Not that interested. We'll go through that some other time. This is the bit that I'm really interested in here. The bones of the cranial base. Now it's comprised of 6 bones. Frontal, sphenoid. You got the ethmoidal right at the front here. I don't know what I'm trying to remember these about. And here on the left hand side, right hand side, you got the frontal, sphenoid. You got the temporal here. On the side you got the parietal bones, ethmoidal. You got the occipital bone here, all joining together to make the cranial base. And these bones, the cranial base articulates with the first, cervical vertebra, known as the atlas, and the facial bones, and the mandible, the jaw. So the reason I bring this up is that the cranial nerves, you can learn them parafashion, but if you learn it in conjunction with the cranial base, it'll be so much more easier to understand and to memorize as well. Otherwise, what you're going to do is you can get these diagrams where it gets the cranial base and they put all labels on it and it gets very, very intense. Let me give you an example. Here, let's have a look. Here we go. I mean, it's even not blurry on the screen. There's so much information going on there, and without the color coding, it gets even more difficult if we just look at a regular scroll. So I'm just going to take that image away. I don't like that image, and I think let's get a bit more color in there and learn this as we go. Now, we're not going to talk about the facial skeleton here or anything. I'm just going to literally just talk about the cranial nerves. I mean, just going to go through them one by one. I think the best thing to do is we leave this diagram on the side here. Let's change the shape of that, and let's move in some other pretty diagrams. Let's have a look here. Just going to try to keep it side by side. Let's zoom into that a little bit. And over here, you've got a picture of the diagram that shows you the structure on the cranial base and what's passing through this. So before I get into that, let's discuss a little bit what are the cranial nerves. Well, cranial nerves are 12 pairs of nerves that originate in the central nervous system. These nerves are loosely based around their functions, or the name based around their functions. In some, we're going to discuss the nerves and what they supply and some background information of what they get up to. So hopefully it might be a little bit easier to understand. It's important to remember that the cranial nerves, the way they numbered them was from front to back, anteriorly to posteriorly. So as they originate out of the brain, you don't imagine there's a brain up here. Actually, let's get a picture of the brain upside down with the cranial nerves coming out of it. It might be a little bit more easier to understand. Let's have a look. Can we get something up? Yes, we can. Here we go. Now I want you to overlap. Let's take that away for now. And let's bring in something else. Let's bring in this. Here we go. So imagine this brain. We've got it turned upside down. We can see all these cranial nerves underneath. In Roman numerals, 1 all the way back down to 12. There's 12 pairs, 1 on each side, symmetrical. And if you can imagine, if you just turn these nerves as they come out and they sit into into this cranial base, they have to match up and sit and come out of these orifices here, and they each have their own function. So I'm hoping that made sense if you hold them side by side. Let's have a look. You got the first cranial nerve. Now, in this diagram, I really like this diagram because it's got the cranial nerve. It tells you what the name is and its function at the same time. Now, cranial nerves, which name because they originate from the cranium, the head, the skull, brain, they have their own particular function. Either it's a sensory function, as in it brings information into the brain, or it has an efferent or motor part, which is an instruction leaving the brain to a particular muscle or organ or particular body part, giving it eliciting a specific effect. So I'll give you an example. You'll get this as we get along. You got the olfactory nerve here, number 1. So the first cranial nerve is called the olfactory nerve. It represents one of the 5 major senses, and it allows for the sense of smell. So the olfactory pathway connects the small little nerve cells detecting particles of air that come up through the nose onto the cribriform plate, which is underneath, in the ethmoidal bone, into the olfactory bulbs, and they detect particles in air, and they relay this information back to the brain. So you got your first olfactory nerves here, and they're communicating through these little cribriform plate in the ethmoidal bone. Now, these cranial nerves, as they're numbered posteriorly, they kind of follow a pattern that goes through all these little orifices and structures. So the second one here, the optic nerve, cranial nerve number 2, goes to what was the so-called optic canal here. So the optic nerve goes to the optic canal. It relays information from the retina back to the eyeball. It goes into what they call the optic chiasm, all the way back to the back part of the brain in towards the occipital region. It has both superior and inferior part, the optic nerve, and it goes to the back part of the brain towards the occipital lobe, otherwise known as the primary visual cortex, which is normally at the back. If there's a brain sat here, it'll be the back part of the brain here. So cranial number 3, also known as the oculomotor nerve, it assists in moving the muscles of the eye and the fibers within. So it provides general somatic efferent and general visceral efferent fibers to the extraocular muscles around the eye, and also the pupillary constrictor muscles within the eyeball. So it's very important to remember the muscles that it does innervate. In particular, we're talking about levator papillae superiorlis, the inferior oblique, the superior, medial, and inferior rectus muscles. So damage to this oculomotor nerve is known as the down and out eye, as in the eyeball will be facing downwards and outwards. It's also responsible for the pupillary light reflex, and it's very important to remember that the oculomotor nerve, even though it's involved in the eye, comes out from the superior orbital fissure right here, not the optic canal where the cranial nerve number 2 is. It's a very common exam question because it's easy to confuse these two. Another one that's related to the eyeball is cranial nerve number 4, the trochlear nerve. Now, trochlear in Latin loosely translates to like a pulley system, like a pulley. And it's named because it's got like a ligament little sling that loops around the muscles before it attaches to the globe of the eye. And trochlear nerve is responsible for only innervating one structure, which is the superior oblique muscle of the eyeball. And the eyeball it assists in depressing the eyeball, and abducting, meaning pulling away from the midline, the eyeball, and Again, this cranial nerve passes through the superior oblique fissure. Next, we're moving on to a very popular one called the cranial nerve number 5, also known as the trigeminal nerve. It's the largest of the cranial nerves, and it contains sensory fibers for the face and also like a motor segment, important for mastication, chewing. The trigeminal word is Latin, tri meaning three, and geminal meaning like a root, or like something that's a group attached to like a common point, like a tree stem sort of thing. I mean, like a tree trunk sort of thing. So, what is referring to the fact that it has three major branches, um, and they all have, and these three branches come from like four distinct nuclei in the brain stem, and the three branches have their own name. Now, this is the bit where it can get tricky because each of these branches leaves through or exits the skull in their own little opening, most of the time anyway. So you got the first branch, known as the cranial branch 1 or V1. It leaves, it pierces the dura mater as it leaves the dura mater of the brain, and it travels through the lateral wall of the cavarious sinus, and it leaves the skull, or the anterior cranial base, or the middle cranial base, sorry, through the superior orbital fissure. And this is different because the maxillary branch, which is the second branch, V2, it leaves through the next foramen in the middle cranial fossa, known as the foramen rotundum. The third branch, known as the mandibular branch, leaves through the so-called foramen ovale, right here. Now, a common mistake when you're revising this, because this can get quite confusing, is to think that the three branches of the trigeminal nerve leave through the three little holes that you see in the middle cranial fossa, as in the foramen rotundum, the foramen ovale, and this little tiny one called the foramen spinosum. Now, the foramen spinosum is not the exit point of the mandibular branch. It will be very confusing. Actually, the foramen spinosum is responsible for, I was about to say use the word carry, but I don't mean carrying. I mean, it is the location where you normally have the recurrent, the so-called meningeal or recurrent branch of the mandibular nerve, where the mandibular nerve, which leaves through the foramen ovale, there's a recurrent branch that comes back through the foramen spinosum alongside the so-called middle meningeal artery, and it divides into two branches, anterior and posterior. And the anterior branch normally communicates with the meningeal branch of the maxillary nerve, whereas the posterior branch is responsible for supplying normally the mucous lining of the mastoid cells. So don't confuse that. The foramen spinosum right here is not the exit point, where a lot of people trip up on this. It's not the exit point of the third branch of the trigeminal nerve, known as the mandibular branch. It's not. So that's the easy one to get confused with. The next one is Abducens nerve, and to abduce means to move away from the midline. And cranial nerve number 6 innervates the muscles that are involved with this movement. So the abducens nerve innervates the lateral rectus muscles, and again, this passes through the superior oblique fissure. And it's easy to confuse these because normally, as you're moving back to how we said the cranial nerves are numbered from anterior to posterior, you would assume a nerve number 6 would be down here somewhere, but it's not really. If you think about it, this located due to function is related to the function of moving the muscle or extraocular muscle of the eyeball. So it has to leave where the eyeball is, which is the closest bit, the closest one being the superior orbital fissure. Moving on to the cranial nerve number 7, the so-called facial nerve. Now this is a very important one for exams because there's a lot going on with this nerve. It has both a motor, sensory, and parasympathetic innervation to various structures on head and neck. You're talking about the muscles of facial expression. You got the oculofrontalis muscle. The ones deeper inside, the stylohyoid muscle, the ligaments, or even muscles in the neck. You're talking about that, the posterior belly of the digastric muscle, the stapedis near the ear. So you got the sensory branches, functional sensory branches. So the facial nerve, it exits the skull via the stylomastoid foramen, and it's not many very important branches that it gives out. That we won't get into too much detail. In this video, you're talking about the greater petrossal nerve and the coda tympani. The one that's responsible for the taste fibers to the anterior of the tongue, and parasympathetic fibers that are responsible for going towards the sublingual and submandibular glands. We're talking about just the general anatomy. When the facial nerve exits via the styloid mastoid foramen, it pierces the parotid gland, the biggest salivary gland. But it's very important to remember that it doesn't innervate the parotid gland, it just goes through it, and it gives 5 branches as it comes through the parotid gland, being the temporal, zygomatic, buccal, marginal mandibular, and the cervical. And also is responsible for innervating the occipital part of the occipital frontalis, and the posterior belly of the digastric muscle, the muscle that, along with the stylohyoid muscle, elevates the hyoid bone. We'll get that into a different video, but that is a very important nerve, the facial nerve. And a common question in the exam is, what happens if you damage or there's inflammation in the stylomastoid foramen? What can you get? Very common known exam question, Bell's palsy. We'll get into it in a different video. Moving on to the cranial nerve number 8, the vestibular cochlear nerve. It supplies the special senses of hearing and balance, and it can be divided into 2 components, the vestibular part and the cochlear part, or the vestibular nerve and the cochlear nerves. And the vestibular nerve travels toward the vestibular system of the inner ear, which detects changes in head movement and to represent balance. And the cochlear nerve travels towards the cochlea of the inner ear, which forms the spiral part, spiral ganglia, which is responsible for detecting sound waves, and is then therefore transmitted as electrical impulses towards the inner ear structures. Okay, so cranial nerve number 9, you got the glossopharyngeal nerve, which is got the both motor and sensory parts. Sensory being responsible for sensing the posterior part of the tongue, tonsils, pharynx, or generally the muscles in the pharyngeal region, for example the stylopharyngealis, and also it has got a branch that goes into the part, supplies the parasympathetic innervation for the parotid gland. Important thing to mention is that there's a little structure there. It looks like a little 8 almost, and number 8, known as the jugular foramen. That's where it passes through. And moving swiftly to cranial nerve number 10, also known as the vagus nerve, literally translates as wandering, because this nerve has a very long course, as it exits the cranial base. It goes from the skull all the way down to the abdominal cavity, and it's got very, very important functions all the way down as it moves from the heart all the way down to the gut. And it's got special sensory, motor, and parasympathetic innervation of everything as it moves down. So the cranial nerve number 10, which is responsible for supplying the somatic motor fibers to two large muscles, the sternocleidomastoid and the trapezius in the neck. And it both enters and leaves through two different foramens, the foramen magnum and that being a big orifice here, and the jugular foramen here, again the one that looks like an H shape. Moving to cranial nerve number 11, the accessory motor nerve. Is responsible for innervating the sternocleidomastoid and trapezius muscles in the neck region. Very important for moving the head left and right. And finally, moving to number 12, also known as the hypoglossal nerve, somatic motor nerve that's named literally because of the location of where it goes to, the muscles under the tongue. And the way to remember this is 4 and 3. It innervates 4 intrinsic muscles within the tongue and 3 extrinsic muscles beneath and behind the tongue. You got the intrinsic muscles, you got vertical, transverse, superior longitudinal, and the inferior longitudinal. And you got extrinsic, the genioglossus, hypoglossus, and styloglossus. Together, the work and allow the tongue to move in all various positions. And that is the cranial nerve number 12. We have gone through this pretty quickly, so I'm hoping to make a video to go through these one by one in more detail at some point. But that was a very basic summary. I'm hoping it all made sense. We went through that a little bit quickly. But I'll post a link to break these down one by one in separate videos. So yeah, I hope that was helpful, and might be worthwhile taking screenshots of these just to let's bring that in just to make it a bit easier. So that's a nice little summary at the end where it shows each foramen and what leaves through it. So yeah, I hope you'll see you in the next video. If there's any questions, again, please just drop it in the comments or just drop me a message, and we shall go through them. And take care for now.